Welcome to the third video in the Tobacco Cessation Strategies for Special Populations series. This video will be geared towards strategies that will help with smoking cessation among Hispanic and Latino populations. This video was created to accompany the Hispanic Latino Outreach Toolkit, which is currently available to tobacco prevention and control coalitions through the Texas Department of State Health Services. In case you are interested in receiving Certified Health Education Specialist continuing education credits, this video will focus on the following competencies. 1. How to involve priority populations, partners, and other stakeholders in the planning process. 2. How to use strategies to convene priority populations, partners, and other stakeholders. And 3. How to identify, develop, and deliver messages using a variety of communication strategies, methods, and techniques. To start off, let's look at some stats. According to the U.S. Census Bureau in 2014, Hispanics made up 14.7% of the population. Among Hispanic individuals, 17.3% of men and 7% of women ages 18 years and over are currently smokers. Overall, the rates of Hispanic smoking are low compared to other populations and have been decreasing over the past 10 years, but significant differences exist among Hispanic subpopulations that are not seen when surveys group Hispanics as a single population. Certain subpopulations of Hispanics smoke at much higher rates. For example, 21.6% of Puerto Ricans and 18.2% of Cuban Americans currently smoke. Smoking rates are also higher among Hispanics of lower socioeconomic status, and smoking rates among Hispanic youth are higher than other minority populations. To start off, it is important to make sure that you understand some key terms that you are likely to hear when working in Hispanic or Latino communities. A few of the key terms are presented here. First, a promotora is a Hispanic or Latino community member who receives specialized training to provide basic health education in the community. Similarly, a community health worker is at the front line of public health, delivering information to communities to facilitate access to services and to improve the quality of health care. You will hear many people use the terms promotora and community health worker interchangeably. Hispanic refers to individuals who are of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish descent. Latino individuals are of Latin American descent. It is important to note that Hispanic and Latino do have different meanings, and people within your community may identify as one but not the other. Culture is a learned system of knowledge and behaviors that are shared by a group of people. Origin refers to a person's heritage or nationality of the person or person's parents before their arrival in the United States. Finally, first generation is the first generation of a family to become a citizen. It is important to keep in mind that as the generations increase, some of the cultural insights may not be as relevant. In the first presentation in this series, we went over in detail the 5 steps for tobacco prevention and control coalitions to use when implementing smoking cessation strategies. During this presentation, we will focus mainly on Step 2, which is developing strategies for outreach with special populations, and in this case, Hispanic or Latino communities. We will now go over a couple of strategies specific to working with Hispanic and Latino communities. The first strategy is to work through community stakeholders to promote tobacco cessation. Your TPCC Outreach Committee will play a primary role in identifying key community stakeholders who can help expand the coalition's local Hispanic and Latino outreach efforts. Ideal community partners will include Hispanic and Latino advocacy groups, organizations that serve Hispanic and Latino populations, and Hispanic and Latino social organizations. Endorsement and promotion of local TPCC activities from the local community establishes credibility among consumers, helps spread information through natural network ties, and ensures usability and effectiveness of smoking cessation strategies. Hispanic and Latino advocacy groups may be formally organized groups with established leadership and infrastructure, or informal groups consisting of local advocates that work together as Hispanic and Latino priorities need to be addressed. If your community has a relevant advocacy group, ask them how and if they would be willing to partner with the TPCC to promote tobacco cessation efforts. Advocacy groups often have existing communication strategies and methods, such as social media accounts, a website, and email distribution lists, to share information with Hispanic and Latino residents, organizations, and businesses. Hispanic and Latino advocacy groups and activities may be embedded in other organizations, such as healthcare organizations, social service agencies, and civic groups that provide specific support or services to Hispanic and Latino communities. These organizations can also be helpful in promoting TPCC outreach activities and in implementing TPCC initiatives. A few examples of organizations serving Hispanic and Latino residents in Texas include the Young Hispanic Professional Austin Association, the Hispanic Women's Network, and the National Latino Tobacco Control Network. Hispanic and Latino-owned businesses can also serve as important partners in promoting tobacco cessation, disseminating information and resources, and sponsoring local TPCC activities focused on the Hispanic and Latino community members. Community members are more likely to frequent places that serve their specific interests and values, so having information available within these businesses or organizations is another way to reach individuals. They can act as a liaison between smoking cessation resources and the target population. While working through local Hispanic and Latino advocacy and social networks will be a good place to start when trying to identify local Hispanic and Latino businesses, there are a few Hispanic and Latino chambers of commerce across the state of Texas. If your community does not have a specific Hispanic and Latino chamber of commerce, your TPCC might want to contact another chamber to find out more about working with Hispanic and Latino-owned businesses to promote your tobacco cessation efforts.
My name is Angie Choud and I am from Colombia. I certified by Texas, State of Texas as a CHW Community Health Worker, and I am currently working in CSW in the clinic for Texas A&M Physician Family Medicine and the program for colorectal screening procedures. I suggest the people for the Latin community is they see or hear programs about the service provider health. They don't need afraid about this. Take these programs, and also don't worry about the documentation, because we don't need a status immigration. We don't need this one.
Another strategy relates to carefully choosing messages for your target community. In order to successfully capture the attention of and communicate effectively with Hispanic and Latino communities, you need to carefully design a message that is meaningful and relevant. You run the risk of alienating people and wasting advertising resources if you assume that a one-size-fits-all approach will work. When designing messages, it is important to be aware of important cultural and historical events. Hispanic culture revolves around holidays that fall into either religious, patriotic, or personal holidays. Festivals and parades often involve a wide variety of vendors and public health outreach organizations. This represents a great opportunity and place to increase awareness of your coalition and show support and understanding for the community. Holidays celebrated within your community may differ based on the countries of origin of local residents or other factors, but we've included a few examples of holidays that might be relevant. These include La Noche Buena, or the Holy Kings, which is celebrated on January 6th. This marks the end of Christmas on the 12th day. Another is El Día de los Muertos, or the Day of the Dead, which is celebrated between October 31st and November 2nd. Additionally, La Virgen de Guadalupe, or Virgin Mary, is celebrated on December 12th, and La Noche Buena, or Holy Night, is celebrated on December 24th. Some patriotic holidays also include Cinco de Mayo, or May 5th, which celebrates the end of the French intervention in Mexico in 1862. On September 16th, Mexican individuals also celebrate El Día de Independencia, or Mexican Independence Day, celebrating independence from Spain in 1810. On the 2nd of October, Mexico celebrates the Day of the Race, or El Día de la Raza, where blending of indigenous people with the Spaniards sparked a new race after America was discovered in 1492. Make sure that you know your community and keep in mind people of different nationalities may not celebrate the same holidays. Also, make sure you are not using out-of-date language in your outreach materials. Although this may be unintentional, it can appear insensitive or hurtful. Keep in touch with local community groups or local liaisons to ensure that you are accessing appropriate language resources and make an effort to stay up to date. As with any community, do not assume that the Hispanic and Latino population is a single group. Keep in mind that people from diverse genders, socioeconomic statuses, abilities, education levels, and geographic regions identify as part of the Hispanic and Latino community. Additionally, subgroups within the Hispanic community, such as Puerto Ricans, Cubans, Mexicans, Central Americans, or South Americans, may have very specific experiences or issues that are not represented in the larger media representation of Hispanic and Latino communities. Consider portraying diverse individuals in advertisements and do not assume that one message will work, even within one special population.
And the community people, for Latin people, the most influential person, or for example, radio station, newspapers, and also in this area is a radio station. The name Radio Alegría is a very, very popular influence information for the Latin person. Also, can be the other influenced people is pastors, leaderships in the churches, high school workers, and the other person is very influenced the people living in this area for a long time because it's more comfortable in the family, Latin family, like a big family, and always try, more speak in our language and Spanish, so they comfortable and it's more safe, these places for this community.
Appropriate messages, you will need to get those messages out to your community. As a TPCC, you may need to develop and implement Hispanic and Latino specific media campaigns to promote tobacco cessation. Bilingual media campaigns that are relatable to Hispanic and Latino people are critical to spreading information in a culturally competent way. Hispanic and Latino symbols and actors of Hispanic and Latino backgrounds should be featured in ads. TPCCs should use different types of media to convey messages to Hispanic and Latino individuals. This might include printed media such as newspapers, magazines, or flyers, and electronic media such as online blogs, websites, and advertisements. Let's start off by talking about printed media. Again, this includes newspapers, magazines, and flyers that can convey messages to your audience. Messages should be endorsed by creditable sources within Hispanic and Latino communities, like social groups or local leaders. Effective advertising can increase knowledge, counteract myths, and motivate people to change behavior. Printed media should send a message that Hispanic and Latino residents will benefit from not smoking and engage the audience in a way that is easily understood. It is important to note that one message will not appeal to every audience, so several messages should be developed that target Hispanic and Latino people specifically. Other examples of how you could use print media could be posters raising awareness for services, billboards, or point-of-purchase posts which engage the consumer as they are making their decision whether or not to buy tobacco products. Integrating both English and Spanish in your message will help reach the Hispanic consumer. Next, let's talk about electronic media, which includes social media. In recent years, tobacco companies have shifted away from promoting their products through traditional media sources like billboards and magazines, and instead focus on digital media and retail outlets. As a result, electronic media sources are especially important in promoting smoke-free messages. Online sources like Twitter, Facebook, websites, blogs, or online advertisements are useful ways to share information about smoking cessation to a wide audience. Again, I will emphasize that differences exist within Hispanic and Latino communities, so messages and approaches should be tailored based on geography, culture, background, or other factors. Social media is a great way that you can build support and reach your intended target audience. It is important to note that resources are always changing, so try to stay up to date with the resources and campaigns that are available to help you. One example of a campaign that you may want to check out is Smoke Free Austin. Smoke Free Austin has materials and information specifically developed for Hispanic and Latino communities. Materials are available in Spanish, including posters and pamphlets that detail the dangers of smoking. Another resource available to you is the Smoke Free Español website, which has a variety of information and resources available in Spanish. There are many other resources, so always be on the lookout for new materials and campaigns that you can utilize.
I suggest the people try maybe change habits, for example, increment exercise and try other activities, because this is the other common problem when the person go to the clinic. I think so, because the person is stressful, the person is very nervous for other country, they need try other activities for this one. So I recommend stop smoking and drink.
As we learned in the introductory video in this series, there are some important considerations when implementing your strategies, such as documenting activities, maintaining community engagement, and leveraging smoking cessation services. Also, be sure to evaluate your activities. You know what works best for the Hispanic and Latino communities in your area. Finally, it's important to consider the sustainability of your efforts. The core elements for sustainability should include buy-in from key leaders and decision makers, leadership of your initiatives, resources and communication mechanisms, and processes to maintain operations or activities. These will differ based on your community and your strategies. For more information about sustainability, see the introduction video at the beginning of the course, or check out the toolkits found on the Texas Department of State Health Services website. As this training comes to a close, we hope that you feel ready to utilize strategies to help close the gap in health equity that exists in Hispanic and Latino communities. Don't let your progress stop here. Take some time to talk with your coalition about some strategies you learned in this presentation. Brainstorm what you feel will work best within your community. We have included several questions here to get you started. Take a few minutes to think through this on your own, and then discuss your thoughts with other members of your TPCC. We want to thank you for participating in this training. For more information, be sure to look into the toolkit for Hispanic and Latino communities that can be found on the Texas Department of State Health Services website.